Our platform has been shown to increase the rate of patients choosing home dialysis 3 to 4 times compared to providers' own benchmarks. And to date, we've served over 250 dialysis clinics, with our first 2 customers controlling more than 80% of the dialysis market. Good afternoon, everybody. My name is Tim Fitzpatrick. I'm co-founder and CEO at IKONA. I spent my last 2 years in the US Navy as a patient in the hospital, and now I'm a patient for life in the VA system. Most of my pain, isolation, and those personal struggles could have been avoided if I had understood my care and my treatment options. Today, IKONA is unlocking at-home care for patients using evidence-based learning tools, starting with patients on dialysis. Our team has developed a VR platform that delivers effective personalized learning and helps patients overcome those barriers to pursuing new treatment options. Our platform has been shown to increase the rate of patients choosing home dialysis 3 to 4 times compared to providers' own benchmarks. And to date, we've served over 250 dialysis clinics, with our first 2 customers controlling more than 80% of the dialysis market. After years of extensive R&D with our partners, including 2 SBIR federal research grants, we brought our product to market in the spring of last year, and we immediately started generating revenue. Since then, we've entered 4 new US states. We've grown our pipeline to include 7 top healthcare provider organizations. And we've expanded our target segment to include 2 large practices with more than 90 locations in 2 states. We just announced our biggest partnership to date with Fresenius, the global kidney care leader. This deal expands access to care in rural communities across Mississippi, where Fresenius operates nearly 140 dialysis clinics. Together, we're excited to continue finding opportunities to improve access to care using IKONA's learning platform. And people at Fresenius are really excited about what we're doing to support their patients. People like Dean, who's seen firsthand how VR empowers his team of patient advocates across the country. Or Jenna, who is one of those advocates on Dean's team. She actually reached out to us after seeing the press release this month, saying she can't wait to have access to IKONA to support her patients in Georgia. Now, why dialysis first? Turns out dialysis is notoriously expensive and complex, and it's rapidly changing. Recent legislation and payment model changes are shifting how and where kidney care is delivered, but providers are struggling to keep up with the new demands. 1 in 5 Medicare dollars is spent on kidney care. And even though 93% of kidney doctors say they would choose to do dialysis at home, just 12% of current dialysis patients are doing so at home. So even though it costs less and it's better for patients, we are still seeing providers struggle to shift patients home. And this problem, frankly, is not unique to kidney care nor to dialysis. Patients' low awareness and fears about pursuing new treatment options is a theme across complex chronic care settings. Over the next 2 years, McKinsey expects as much as a quarter of traditional care services to shift into the home environment for patients. IKONA is going to be a key role in that shift. We are just scratching the surface with the dialysis market. Our platform will allow us to adapt our evidence-based learning tools for multiple markets and care settings. We are already seeing demand for commercial products in earlier stage kidney disease, transplantation, type 2 diabetes, and infusions. Our team of 12 is led by people who have designed, built, and scaled products in this space before. We have top minds from the fields of learning science, clinicians who understand these pain points, and operators who know how to deliver solutions that scale. We are raising our first institutional round of capital to hit our growth milestones, and just received a term sheet last week from a fund led by some of the best founders and investors in medtech and social impact. We have 3 to 4 spots remaining for institutional checks to close out this round, and we are looking to meet investors with experience in enterprise healthcare, edtech, and emerging technologies like virtual reality. Thanks for your time.
Tim, that's great. Appreciate that. What's jumped out to me was the 1 in 5 Medicare dollars, and then the 16% less expensive, but then the list of chronic conditions that this could be extrapolated out to. It's fascinating. Tell me quickly what the patient experience is like using IKONA.
Sure, absolutely. So we do have some examples to share here. I think it's always fun to talk about what VR can do in 2 dimensions, as you know, but when a patient receives this headset, let's say a clinician front lines in one of the dialysis clinics using IKONA, puts it on the patient, helps them get set up. It's pretty easy to use. It's straightforward. We spent a couple of years getting this right with our partners, and they are here meeting, in this case, Julian. They are hearing firsthand how Julian has been in their shoes, how he's overcome those hurdles. And our job is to help reduce anxiety so that we can teach, right? This is a stressful situation. Patients on dialysis, it's a loud environment, like infusions. First thing you need to do is to help patients feel comfortable and feel like they can do this. And then from here, it's a matter of helping them know that this transition is possible, it's doable. Patients have done this before you, and you're in good hands with this platform.
We've got a question from the chat. Has any research been published to document the improved outcomes after using VR?
Certainly. So IKONA published 3 papers in the last 12 months. I'm happy to share that after this. Those are in Digital Medicine Journal, as well as the leading nephrology nurse journal, that is NNJ. We presented these outcomes at the most recent conference, and we're going to be presenting again at Spring Clinical Trials. Happy to follow up. But we have published data around those reductions in anxiety, improvements in the adoption of home modalities. And we're excited to show learning progress, health literacy, and follow that pathway into patients' homes as well, with papers expected to come out later this year.
You mentioned that you were bringing in revenue. Explain to us kind of what that model is, how you're making money today.
Absolutely. So the IKONA is an enterprise license model. So we offer enterprise kits into these dialysis clinics. We primarily grow, as we know, 2 companies own most of the first market, so that's landing and expanding. And we have a milestone based on the number of clinics that we hope to enter, with 2 to 3 kits per clinic. Exciting. The next piece of our journey is introducing usage-based pricing. So we are already doing that with our contracts in the pipeline, where we assign a value to an individual patient, and we can follow them from the first time they find out about their complex care diagnosis through onto dialysis transplantation. And that's going to open up our TAM, but it's also going to allow us to support our customers on a much more granular perspective for ROI.
Now, this is obviously a next generation concept when you think about standard care in a dialysis center, but obviously VR is taking off. Is this a competitive landscape, and sort of how do you set yourself against competitors?
Yes, so VR is, excitingly, we've seen great examples from surgical training, for example, where they're measuring competency for surgeons. We believe that should exist in patient care. It does not exist yet. So where we have seen patient-facing VR taking off is behavioral health, things like mental health, which is a wonderful application. We're excited to have that pull from our customers as well around mindfulness. We think about differentiation among care management, frankly. So as we start partnering to support the ways that physicians and care teams make decisions about care, we want to be the reason they're able to confidently say, this patient understands the care plan, they can follow the care plan successfully, and they can do things like treatment adherence, speed time onto effective treatments, stay on something like home dialysis successfully, where we know there are high rates of rehospitalization and recidivism. So that's the opportunity we're excited about, and want to make sure we're differentiated within care management, within VR, and within learning, for that matter.